Good morning, ma'am. My name is Carl Japites Sabonero from Base 1B. So for today's video, I'm going to show you my return demonstration on hygiene. So for the definition, it is a type of bath given while the client is on bed. For the purpose, to make client clean and feel comfortable, and to increase sense of well-being, and also to promote muscular relaxation and relieve feelings of fatigue. So for the assessment, assess client's tolerance to activity, then assess room temperature and ventilation. And also for the planning, wash hands, gather all necessary equipment. And for the implementation, identify the client and explain the procedure. And then provide privacy. And then offer bedpan or urinal. Adjust bed to comfortable working height position. Then place bath blanket over the client before removing the top sheet. Remove client's gown, ensuring he or she is covered with bath blanket. Then place client in semi-fallows position and remove pillow if permissible. Then pull side rail up and fill basin with warm water. Then make a mitt of the washcloth. Then wash client's eyes from the inner canthus towards the outer canthus. Wash client's face, ears, and neck. Then rinse, pat, and dry. And then wash arm far from you, distal to proximal, including axilla. Then wash arm far from you, distal to proximal, including axilla, using long firm strokes. And then rinse and dry. Repeat to the procedure on the arm near you. Wash client's hands in basin, then rinse and dry. Then wash chest and abdomen using long firm strokes, rinse and dry. Then expose one leg at a time and wash leg far from you with long firm strokes, rinse and dry. Then Repeat the procedures on the leg near you. Immerse and wash client's feet in the basin, rinse and dry. Then replace the water. Turn the patient on his or her side and place a towel alongside of the back. And wash the back and buttocks with long firm strokes and rinse and pat dry. Then place the client in supine position and cover with bath blanket, and then wash the perineal area and rinse, pat and dry. Then, if patient is able, place a towel under the buttocks and bring basin and soap within client's reach. Instruct client to complete the bath him herself. Then have the clients wear new gown and comb hair. Apply lotion if desired by client. Remove equipment used and store, wash them in proper place, and wash hands. So for the evaluation, evaluate the client's comfort, and for the documentation, document the procedures to include type of bath administered and client's response. So for the sponge bath assessment, determine the need of the client, and also for the planning, don't forget to wash your hands, assemble equipment needed. For the implementation, identify and explain the procedures to the client. Then take the client's temperature. Then fill basin with water appropriate temperature of about 29.5 Celsius to 32 Celsius. Then drape the client with bath blanket and roll top sheet to the bottom of the bed. Remove patient's gown, exposing only the areas to be bathed. Then sponge the client's face and forehead with plain water. Do not dry. Sponge and massage the body area in rotation like arms, legs, and back. Moisten them for several minutes but do not dry after sponging. Sponge and massage body area in rotation, neck, arms, legs, and back. Moisten them for several minutes but do not dry after sponging. Then reassess client's body temperature and pulse after 30 minutes. Discontinue bath when desired temperature is reached, usually lasting for 20 to 30 minutes. Bath the client Dry when bath is complete. And then place client in a comfortable position. Put on a clean gown on the patient. Then put on a clean gown on the patient and remove equipment used, and then don't forget to wash your hands. And for the evaluation, we assess the body temperature. And documentation, record the type of procedure, rendered body temperature, and the client response. Okay, for the hair shampooing, for the assessment, check doctor's order for hair shampoo. Assess the patient's condition like manifestation of fatigue, level of consciousness, and hygiene needs. So for the planning, determine the need for assistance, gather all the equipment needed. So for the implementation, identify the patient and explain the procedure, provide for privacy, raise the bed to proper working level, and then wash your hands. For the hair shampoo, as follows: fan fold the top linen to the feet and position the bath blanket over the patient. And then position the patient diagonally in bed. And then place cotton balls on each ear fold. Then cover the eyes with folded washcloth. Then place a towel around the patient's shoulder and neck with the ends of the towel coming together in front. Then place a Kelly pad under patient's head with through extending to the receptacle for water. Then wet the hair and using a small amount of shampoo, lather it on hair and massage the scalp with fat pads of the fingers. Rinse thoroughly and apply cream rinse and as desired by the patient. If hair is so dirty, repeat and step edge. Then rinse thoroughly. Remove the Kelly pad. Pull the towel around the patient's shoulder to dry the hair. Then comb or brush and arrange the hair. Allow the patient to assist if able. Then remove the rubber sheet and other equipment. Replace the patient in a comfortable position and also don't forget to wash your hands. For the evaluation, watch the patient carefully for signs of fatigue and evaluate as to comfort and cleanliness. For documentation, record the procedure done. So for the back rub, for the assessment, check chart for information related to the client's ability to participate in the procedure being planned. Assess the vital signs, and for the planning, determine assistance needed and determine and obtain articles needed. For the implementation, identify the client, ask the procedure to the client, ask preference of rubbing agent, and provide for privacy. So, maintain a quiet and relaxing atmosphere. Move the client near to your side and position. If client is able to move, instruct her or him to assume sitting prone position. Then wash dry back if necessary. Pour small amount of rubbing agent into hands and rub hands together. Place hands on sacral area while maintaining good posture. Make a long firm strokes towards shoulders and back towards buttocks. Move hands towards neck and rub nape. Continue rubbing outward across the shoulders. Move hands downward to the scapula and massage in circular motion. Rub in 18 pattern over buttocks and sacral area. Then complete back rub by moving from shoulders to sacrum and back to shoulders. Remove the existing rubbing agent used with towel. Then reposition client and replace to top linen. Raise side rails and place call light within reach. Return articles used in storage area and wash hands. So for the evaluation, evaluate terms of the following criteria: A. Fatigue, subjective feelings, objective appearance of comfort, and also for the documentation, client's response to back rub, condition of skin and bony prominence. And lastly, BP and PR or before and after the procedure.